certified child, adolescent, and adult psychiatrist, and she's going to be giving we're going to format it as a 10-minute brief presentation on each of the topics and save some time afterwards for questions and answer. So Dr. Lisa Bell is going to start us out with her presentation, and then I'll follow her with another brief 10-minute presentation, and followed by me would be my colleague, Dr. Alexis Clark, who's a certified, licensed psychologist. So if Dr. Bell is there, I can't see you on my screen, but if you want to go ahead and start or say any intro words you'd like to offer. You may need to unmute yourself.
Well, thank you, Dr. Sangster. Good afternoon, everyone. Thank you for allowing me to present this very important information. Like Dr. Sangster said, I'm a board certified adult as well as a child and adolescent psychiatrist of 32 years. And most of my career, I've provided care for children and adolescents from the ages of 0 to 18. I would say 25 years, working in the communities such as Inglewood, Michigan, Indiana, as well as Illinois, and the juvenile justice system. Today, I'd just like to briefly talk, because I am an adult psychiatrist, about the percentage of mental illness among African Americans in America. Then I would really briefly go over child and adolescent issues during COVID. So here in America, 13.4% have described themselves as being African American or Black. Okay, out of the 13.4%, there's 7 million of us that have some form of mental illness. That would be 1.4 million being seriously mental ill and 4.8 being some form of mental illness. And this has increased after during the pandemic and even now. So if we look at Chicago, Houston, and the populations of Philadelphia all together, that's the amount of people, African American in this nation, that suffer some form of mental illness. Okay. Black and Latino children and adolescents have witnessed more infections, more illnesses and death from the corona pandemic virus. So the families have suffered a disproportionate economic setbacks, as well as the Hispanic and immigrant groups have been mostly been affected by the loss of their jobs. So that puts us at risk for food insecurities, unstable housing, and then, because everyone's at home, that increases the domestic violence in the home, child abuse and neglect. This stresses the adults in the Black and Latino communities because we're at a disadvantage. For the last 400 years with slavery, Reconstruction, as well as Jim Crow laws, we're already at a disadvantage. Before COVID, 1 out of 5 children here in this nation had been diagnosed with a mental illness. Now, after COVID, there's been a lot of different changes. From January the 1st of 2020 through August the 31st of 2020, the suicide rate was stable here in the state of Illinois. It increased. So now, as of, let's say, 2019, there's a special report by the Congresswoman Bonnie out of New Jersey, the Democrat out of New Jersey with the Congressional Black Caucus, put together a task force because there's an increase, there's an emergency among the suicide rate in our Black children, particularly our African American boys. As of December 2019, the second leading cause of death among African American boys ages 10 to 14 is suicide. The third leading cause is among those African American boys ages 15 to 19. And just 3 weeks ago, we had a boy commit suicide, as well as November. So what we're seeing with this pandemic is an increase in mental illness among our children and adolescents, because, like I said, we're already at a disadvantage, having poor social economic disadvantages, education, redlining as far as housing and jobs. So our kids suffer the most. And the most frequent illness that we see in the psychiatry field, adult children adolescents, any age group, across the board, is anxiety. Anxiety makes up the majority of mental illness in this nation. I would say about 66%. And anxiety in an adult is different than anxiety in a child or adolescent. A child and adolescent, they're going to present maybe differently behaviorally. If the anxiety is a post-traumatic stress type of anxiety, they're going to be hypervigilant, may become aggressive, sometimes to a point, may even start hallucinating or seeing things. A young child is not going to tell you I'm anxious because I just walked to school and I saw that my friend's mother passed out. She had COVID, or so what you're going to experience. They're going to come home. They may be aggressive, not eat, not sleep, not be able to focus. And so anxiety, I would say, would be number one, what we're going to see in these kids, because their parents is experiencing this type of anxiety during the pandemic. Uncertainty about jobs, catching the virus, going to work, because we make up the majority of with Latinos, Latinx frontline providers as far as the workforce. So and we're the number one group of individuals who are affected by this virus, and we're being treated differently when we do arrive at these hospitals. The second one would be depression among children. They're not going to tell you they're depressed, particularly someone that's less than the age of 7. They're going to act it out. They're going to be regressive. Some overeat, some undereat. Some may not sleep, some act out behaviorally. And there's other symptoms secondary in these children secondary to the pandemic. But there's 5 mental health treatment issues in children, minority children and adolescents. The first one being stigma. This is a disdain on our reputation. We want to cover it under the rug. And Black people, as Black people and African American, Latino people, minority groups, we don't go to professionals. It's an embarrassment. The second reason is misdiagnosis, because people don't look like us, they don't talk like us, they don't understand our culture, who we are, they're not respectful to us. And most of African American providers, there's a small percentage of mental health providers. I think it's 2% African American psychiatrists in this nation, and there's about out of 30,000. That's a small percentage, and even lower percentage of child and adolescent psychiatrists, because they misdiagnose us. And in the past, they overdiagnosed with schizophrenia, with more serious illnesses. Cultural utilization. We don't go to psychiatrists. We don't go to mental health professionals. We take care of it at home. I'm trying to rush through this, Dr. Sangster. Poverty utilization. We have insufficient funding. If a child comes to me, a parent said, Dr. Bell, I want to take my child to see a child psychiatrist. I know that you no longer practice in Inglewood. It takes 4 to 5 months to get an appointment. Even if you have if you have Blue Cross Blue Shield, these are the issues. Poverty utilization. So we're the first people to arrive at the emergency room for acute treatment. So we don't believe in prevention. And then trauma, adverse childhood experiences. Every day you hear about violence, you see about it. These kids, I remember over the last summer when they were rioting, a young girl kept saying, told a police officer, are you gonna shoot me, when she was marching with her parents? Adverse childhood experiences from the ages of 0 to 18. There was a study done in 1998 by Feletti at a HMO in California, where 32,000 people filled out a questionnaire. Have you experienced from the ages of 0 to 18 any of these problems in your home growing up? Did someone in your family witness violence? Was there domestic violence? Was someone murdered? Did someone have mental illness? Did someone smoke? Was there any neglect? Was there any physical illnesses? So if you had one, it increases your chances of having some illnesses later in life. If you had 3 or more, it increases your chances after the age of 18 of having diabetes, hypertension, high cholesterol, increased smoking, heart attack. So these are some of the issues that we have. So here in Illinois, of the 20% of children who have mental health problems in Illinois, only half have received treatment. So these are the issues. But we know that we are resilient as a people. And prayer, we come together, the prayer increases our resilience. We've had to overcome We have to make it through slavery, like I said, Jim Crow, Reconstruction. But what's happened with our kids? What's going on with our children and our adolescents, particularly our young Black boys? Well, what's happened to the community? We know the African proverb, it takes takes a village to raise a child. Where's the village? Where's the community? What happened? What happened to our resilience? Because I know when I grew up in the 60s on the west side of Chicago, there was a community to say, hey, wait a minute. We know that you're not socially, mentally, and emotionally developed. Wait a minute. They put their hands on me. Everybody would rear me. So that frontal lobe is not fully developed until you're 27 years of age. And the frontal lobe is responsible for impulsive behavior. So this is the issue that we have. So what's happened to our resilience? Well, I think it's being affected now that the suicide rate among our African-American boys have risen. I know I could talk more, but I do, and I'll share it at the end. So I'm gonna go ahead and stop there, Dr. Sanchez. I think I've said a lot, and I try to say as much as I can in a small amount of time.
Okay. All right. Thank you, Dr. Bell. We
Okay.
appreciate it. Well, I'm going to go ahead and start my presentation. I'm going to actually, going to overlap somewhat because I'm going to talk about also depression and anxiety and how these conditions are present in adults in the community. First of all, I just want to start with the definition depression. We all feel a little down from time to time, whether we're going through a difficult time with work or have fallen out with our friends or just having, falling out with friends or family, just physically run down. Most of us feel sad or a little depressed once in a while. So how do we know if our feelings are a normal emotional reaction to stressful times or whether they're suffering from symptoms of major depression? I'd just like to submit about 10 questions for you to ponder on, and that can give you some sense of if you're depressed or not. One, are you suffering from feeling of sadness, hopelessness, or emptiness? These are some of the cardinal symptoms of depression. Two, did you find it hard to find pleasure in activities that you used to enjoy? Three, has your appetite changed? As Dr. Bell mentioned too, as in children, appetite can increase if you're depressed or decrease. Most adults lose their appetite. Okay, number four, are you lacking energy and motivation? Okay, five, has your sex drive changed? And just to clarify that maintaining a sex drive does not necessarily mean that you aren't suffering from depression. Some people can, still perform even though they're depressed. Six, are you having trouble getting to sleep and staying asleep? Or are you finding it hard to get up in the mornings? Seven, have you had thoughts of harming yourself or ending your life? Not having this does not mean that you don't have at least mild or moderate depression. But if you are having thoughts of ending your life, that is serious that you would need to see someone or get to your nearest emergency room. Um, Eight, do you feel guilty or tearful for no reason? And nine, have you recently suffered a traumatic event such as bereavement, loss of a loved one? Okay, a low mood or feelings of hopelessness without any trigger more than a few weeks is a cardinal symptom of depression. And 10, do you find yourself avoiding friends and family? If you've answered affirmative to most of those, you are encouraged to see a clinician or someone that you can talk to. Now, I like to slide into the issue of anxiety disorders. As Dr. Bell said, anxiety disorders are the most prevalent disorders that we see in the mental health field. And just to give a brief overview, experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense and excessive and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, which can develop into a panic attack. To describe a panic attack briefly, people feel like they're dying for no apparent reason. You get short of breath, you get sweaty, your heart rate increase, and and those show up in the emergency room quite often. And it's really a anxiety or panic reaction. These feelings of anxiety or panic interfere with daily activities and are difficult to control or out of proportion to the actual danger and can last a long time. You may avoid places or situations to prevent these feelings. Symptoms may start during childhood or teens and even continue into adulthood. Examples of anxiety include generalized anxiety disorder, a social anxiety disorder, or social phobia, specific phobias, separation anxiety. And some of the common symptoms of anxiety will present as feeling nervous and restless or tense, having a sense of impending danger, panic, or doom, having increased heart rate, as I mentioned earlier, breathing rapidly, or we call hyperventilating, sweating, trembling, feeling weak or tired, or having trouble concentrating or thinking about anything other than the present worry. Okay, there can also be some medical causes that can bring on anxiety as well. For example, heart disease, diabetes, misuse of drugs or withdrawal from drugs, and chronic pain. Um, so, when do you feel it's time to see a doctor? When you feel like worrying so much that it's interfering with your work, your relationships, or other parts of your life, that's when it's time to see a professional. Your worries may not go away on their own, and they may get worse over time if you don't seek help. You should see your doctor or a mental health provider before your anxiety gets worse. It's easier to treat if you get help early. So, and then just moving forward to talking briefly about the effects of COVID on us. As Dr. Bell also mentioned, during the pandemic, there's about 4 in 10 adults in the US that have reported symptoms of anxiety and depression. And this is up from 1 in 10 prior to the coronavirus influence here. As the pandemic wears on, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health outcomes, such as isolation and job loss. Those are some big things that we are seeing. The young adults experience a number of pandemic consequences, such as closures of the universities and loss of income, and that may contribute to their poor mental health as well. Prior to the economic downturns, shows that job loss is associated with increased depression, anxiety, distress, and low self-esteem. And these may also lead to increased rates of substance use, which we also are seeing. The pandemic has disproportionately affected the health of communities of color, non-Hispanic, Black adults, and Hispanic or Latinos are more likely to report symptoms of anxiety and or depressive disorder than non-Hispanic whites. Historically, these communities of color have faced challenges accessing mental health care. Dr. Bell mentioned also that we tend to be the essential workers, in the grocery stores, restaurants, and delivering essential services. But yet, on the other end of that, we have lack of access to mental health or medical health care services. So that's why we have seen a disproportion of us affected and dying during this pandemic. Adults experiencing household job loss during the pandemic have consistently reported higher rates symptoms of anxiety and or depressive disorder compared to adults not experiencing job loss. Has been a big issue too, as we've seen what's going on in our economy. So many people are underemployed and having challenges just meeting day-to-day expenses as well as having food. Job loss may lead to other adverse mental health outcomes. As I mentioned, substance use disorders. They are also on the rise during this pandemic that we are currently in. Throughout the pandemic, we find that adults in households with children under the age of 18, compared to adults of households without, are slightly more likely to report anxiety and depression. Women have been more likely than men because they tend to be the primary caretakers of children in these homes. Um, so, um, Another thing I'd like to share about how it's affecting the communities of color, the pandemic's mental health impact has been pronounced among the communities of color, also experiencing disproportionately high rates of COVID-19 cases and deaths, as I mentioned earlier. Black and Hispanic adults have been more likely than white adults to report symptoms of anxiety and or depression during the pandemic. This disparate mental health impact comes in addition to Black and Hispanic communities experiencing disproportionately high rates of coronavirus cases and deaths overall, as well as among healthcare workers. Okay. There's so much information, and I was trying to make it concise and present it in a reasonable fashion. But I'll be done in just a minute here. Pre-pandemic shortage of psychiatric hospital beds has also worsened with the surge of COVID-19. Patients needing beds in hospitals across the nation. There's lack of beds even. So finally, history has shown that mental health impact of disasters outlast the physical impact, suggesting today's elevated mental health need will continue well beyond the coronavirus outbreak itself. So we do have to brace ourselves for the road, for a long haul down the road, and particularly with mental health of our beloved community. And I know we are a resilient people, as Dr. Bell has shared. We've come through the Middle Passage. We survived so much. And I know that our God will get us through this too. So with that, I thank you. And I'd like to go ahead and pass the baton on to my colleague, Dr. Alexis Clark.
Hi, everyone. So that was kind of a lot of information in terms of like how, of course, COVID is impacting our community. But there are certainly things that you can do in terms of how to manage symptoms of depression and anxiety. One of those things is that what we know is that how you think about things impacts how you feel and then what you do. So in this COVID world, it's left a lot of us feeling very powerless. Like there aren't things for us, that there aren't things that we can do because there is so much that is outside of our control. So if that is kind of the frame of mind of how you're thinking about things, then you're more likely to feel more anxious. You may be more likely to not want to leave the house, may be more likely to, have higher levels of anxiety, that kind of thing. However, if you kind of challenge that kind of thinking and just remember that there are things that you can do. So for example, if you are wearing your mask, if you are washing your hands, if you are following the CDC recommendations in terms of how to manage COVID, right? Then you are not just powerless, right? Like there are specific things that you can do to help minimize those kinds of things. And so it's very important for you to be mindful of what we call twisted thinking. And really challenging those and being very intentional about challenging those kinds of things. And so I'm just going to give some examples. So one would be overgeneralizing. That's a huge one. So having very automatic thoughts and having one experience and then relating it to a whole bunch of different experiences when that may not necessarily be true. Another one would be mind reading. So thinking that you know what somebody else is thinking. So whether that be a spouse or a friend, feeling like you know what they're going to say, that kind of thing, is not necessarily helpful. It would be more helpful for you to ask, right? Like, what is it that you are feeling? What is it that you're thinking, so that you're not making assumptions? And again, those assumptions then controlling what it is that you're feeling and then what you do. So those are just some examples in terms of how to challenge the ways that you're thinking. Other things that you can do are what we call relaxation exercises, or meditation is another one. One specific exercise that can be very helpful is one thing that we call progressive muscle relaxation. So for example, with that one, what we encourage people to do is to tense the various parts of their body. So whether you want to start with your head or to start with your feet, but you're going to tense each part of your body. So let's say you want to start with your head. So you would tense that for like 5 seconds. And then as you're doing that, you're taking in deep breaths and being very mindful about your breathing. And then as you're releasing, then you are like releasing the tension after you kind of tense those different parts of your body. And so what that does is it will help, relax the different parts of your body. And it can help to lower your heart rate if you are feeling anxious, or if you're feeling like having a hard time controlling your thoughts, that kind of thing. Those kinds of exercises can be really, really helpful. There are other things, of course, like exercise can be really helpful in managing feelings of depression and anxiety, having a balanced, healthy diet, doing fun activities. So whether that be, the weather is really nice outside now, so taking a walk, getting outside to get that vitamin D. Again, being mindful, right, of wearing your mask, being socially distant. Again, there are things that you can do to help minimize the risk. Doing other things like listening to music. That can be certainly really, really helpful in terms of managing feelings of depression and anxiety. Watching comedies, right? Getting those endorphins flowing so that you can help to increase your mood, right? When you're feeling down or depressed. There are also, in terms of specifically with Black people, right? Like there are resources and Black providers that are providing therapy, or if you do need some kind of medication. So there are, I'm not sure people are aware, but there's an Association of Black Psychologists, which I am also a member of, but they also have a directory. So if you're specifically looking for Black mental health providers, there are also resources. One is called the Men's Wellness Circle, specifically for Black men, and it's a resource for Black men to come and talk about stressors, about how to manage that, facilitated by a Black male psychologist. And so all of these kinds of resources I will also I'll send it to Dr. Sangster, so that people have more specific places to go. There's also the Black Mental Health Directory, which again is a resource that has a listing of different Black mental health providers in the Chicago area. And then I'll also send along some more specific guide with some of the things that I've talked about in terms of whether that be challenging negative thoughts, or more specific ways of whether that be music, meditation, more relaxation, things that people can also start to practice in order to kind of manage these kinds of symptoms that they may be experiencing. And I'm gonna leave it at that. I think mine was pretty quick. But of course, if people have questions or concerns, I'm definitely open to that.
Okay, but thank you, Dr. Clark. And now, let's see, Madam Chairman, about how much time do we have for questions and answer?
You have about 15. Go ahead.
Okay, so we're just going to open it up to the Deacon Ministry. Anybody that have any questions of the three participants, feel free.
I want to say, Dr. Sangster, that I gave Mrs. Poole a list of African-American providers.
Mm-hmm.
I forwarded to you last evening from Dr. Ernest Webb, a clinical psychologist. Also, there's an app for children called Safe Place. If they can download it in the App Store if they feel suicidal, because that's on the rise, particularly here in Chicago. Chicago, Maryland, and Connecticut has seen an increase in depression and suicide rates among African-American boys over the last 2 years.
This is Deacon Stella Purdy. I just want to say thank you, Dr. Bell, Dr. Clark, and Joe. That was a phenomenal presentation. Truly enjoyed having the information and also having the information to follow up when needed. Question, Dr. Sangster, can you send to us the 10 questions that you started out with your presentation? Ask questions of whether you are depressed or suicidal or whatever that may be. Those were really great.
Okay. Yeah, that won't be a problem. I can go ahead and draft that and send it out. I don't know. I can leave it with the Madam Chairman, maybe, so she can distribute it as she sees fit.
Okay, that'd be great. And I guess the larger question that I don't know who can answer this. We have a lot of, when we do our deacon calls, we come across a lot of our members who are going through quite a bit. How do we deal with that when that's presented to us? Does anyone want us, can anyone address that? Joe, as a deacon, you know, the kind of, we have a variety of members who are going through a lot of things. And I would not want to, I don't know if it's correct to recommend that they could see someone. We will pray with them, and we know that God changes prayer, but God puts you psychologists and psychiatrists there for a reason. So how can we address that?
Well, I'll take a stab at that because being an ordained deacon as well as a psychiatrist and mental health professional, and you know, we do visit the sick and shut in, and we see them in various stages of physical as well as emotional health. Um, I guess, you know, as providers, we have to be aware that, you know, if they're in a space where they are at risk of hurting themselves or hurting someone else, you know, or not taking care of their basic needs, you know, we are like, well, we are mandatory reporters, but then as deacon ministry too, you know, we need to be able to contact someone that could get that person in a better situation or condition. And otherwise, on the other hand, I mean, sometimes people are just, you know, depressed from being ill or sick for so long. And, you know, as ministers, we go in to help to minister to their spiritual needs mostly. But, you know, we do pray and, you know, just show concern as best we can. And most of the times, you know, the members do respond, you know, just to be able to uh, speak to where they are and what's going on with them, whether physically, mentally, what's going on with them, and do appreciate our visits. So I mean, we do a powerful work as a ministry, but we also must be aware that if they are in such danger or threat to their own integrity, we have to be able to act, you know, to get them to a professional and a safer place.
So when I first encounter hear from about an adolescent having some issues, or a 5-year-old or 7-year-old, I usually hear from a pediatrician or from a school principal. This is the first contact when they contact me. Right now, I'm not practicing child psychiatry here in the state of Illinois right now, but I practiced in Inglewood for 15 years, and most of the neighborhoods throughout Chicagoland area over the last 32 years. So that's the first person that young person is going to talk to, that pediatrician. They usually have a good relationship, I hope, with the pediatrician or someone in the school setting. Majority of children and adolescents, their first contact with mental health care is in the school system. It's not DCFS, it's not a mental health professional, because it's a shortage, and then, you know, there's a stigma. By the time they get to me, it's usually they're not in a good place. Very rarely it's in the beginning stages. They've already been searching for care. By the time they get to me, I embrace them. First thing, I pray with my patients. I kind of censor the parents, and I reach out to the African American or other mental health professionals who are culturally competent that can talk to my patient, can meet them at their level. I'll refer them to them, like a social worker. There's about 4% of minority social workers in America, and 2% psychiatrists. So I don't know about psychology. I think it's even less. I think it's 1%. You know, so I would say have them pray with them, have them contact the pediatrician, usually based on their insurance or their HMO. There is a person they can contact. But there are a lot of different avenues or different websites where they can find care. And I wrote them down, but I can send those, well, Mrs. Poole, I can send that to you for children and adolescents, particularly LGBTQ community, because I've been really involved with their care on the north side of Chicago, particularly the children who I've served who are going through the transition and they get their care out in Northwestern. And as you know, a lot of people who work in Northwestern don't look like us, talk like us, or act like us. And it's also important that when we refer our children and our adolescents in particular, that we refer to people who are culturally competent. I've written this book, and bless his heart, my late mentor, Dr. Carl Bell, wrote the foreword. In this book, I have about 12 contributors. I have a female Black addiction psychiatrist, Dr. Beatrice Brewer. She's in this book. So there's a lot of different professionals, social workers from every discipline, geriatric psychiatrists, So this is an avenue. It's on Amazon.com where you can get information. These are predominantly Black people, mental health professionals, psychologists, social workers, speech pathologists. Arnell Brady, who also has a chapter in here about his experiences and how to provide culturally competent care for people who don't look like us. And I've been asked recently by the Department of Education, by the federal government, on June the 16th to give a lecture to 500 people, the Department of Education for, I think about, I don't know how many superintendents, about cultural competency, about the state of the effects of COVID in marginalized communities on June the 16th. So I'm gonna take them back and bring them forward, and I'm gonna let them know that we need to invest. Okay, so Reverend Wright told me, Jeremiah Wright, I talked to him about, he just told me to put it out there. I'm gonna put it out there. So also in this book, I also have Reverend Moss. I interviewed him on my trip to Ethiopia. So I made a tribute to him. So he was very influential in me writing this book.
I just wanted to add, I think things like this are also really helpful just because I'm hoping that it provides an opportunity to kind of normalize mental health services, right? Going to therapy does not mean that you're crazy. Going to therapy does not mean that, that something's quote unquote like wrong with you. Everybody goes through things, and going to therapy is an opportunity for you to be in a space, hopefully what it should be, a non-judgmental space, for you to figure out how to kind of manage the various stressors that we're going to experience in life. And so if you have somebody that's coming to you that you feel like needs therapy, it sounds like all of us have kind of like a list of resources. So that could be also an opportunity for you to give to people that you feel like that those kinds of things would be helpful.
Thank you, everyone. Thank you so much.
Mm-hmm.
Deacon Yvonne had her hand up next, and then there's a question in the chat box.
Hi, if you guys can address, over the last few weeks, businesses have had their employees starting to come back, and there's a significant amount of anxiety. Any recommendations on how supervisors can help their employees sort of work through the anxiety? We've had folks that actually sat in their cars all day. They couldn't come into the building. So it really is having a significant impact, I think, not only on people, but also on the work they need to do.
I think it's a responsibility for that organization or for that employer to educate their staff and their employees, number one, about COVID, because that's the number one anxiety. What is the truth behind, as you know, in the minority community, the Black community, 36% of young people have yet to even receive the first vaccination. So they need to be educated about it. Maybe this will decrease their anxiety. The second thing, like Dr. Clark talked about, prevention, wearing your mask. There has to be maybe pamphlets that go out to the groups, or maybe they can meet in an area. Maybe they can be, once they arrive, they can have some type of question and answer or some type of medication or downtime for 10 to 15 minutes every day before they start the day. Maybe that's an avenue. But one of my pet peeves, and one of the things that I focus on most of my career, is education about prevention, about what is existing in our communities as far as mental health, particularly for African American children. That's the big issue. We're not going to solve this problem until we talk about prevention. So I don't want to go off on a tangent. I understand the question that you asked, but I think if you educate a group of individuals who have uncertainties and anxieties about a situation in some form or fashion, or offer some type of meditative relaxation techniques, or meet like a lunch, you maybe even have a lunch question and answer place at a distance, socially, social distancing and practices as far as washing your hands, that should decrease their anxieties if that corporation or institution educate them. So
the question in the chat was from Reverend Marietta. She asked, is there a hotline number to call, or should a person just dial 911?
So I was looking for the number for 1-800, let me put it in here, 1-800-233-878-TALK. That's the suicide. Let me write that in the chat, okay? 800-233. That's taught. So this right here is a hotline for suicide. We'll put it in parentheses. I'm putting it in the chat.
Mhm. And while Dr. Bell is doing that, I just want to piggyback on the piece of educating people with Dr. Collins' question about employees afraid to enter their workplaces and spaces. You know, keeping up on what's current too, in terms of, you know, the CDC and what they're recommending, you know, the Illinois Department of Health. Also seeing the news on the percentage of vaccinations and how things are gradually starting to open up, you know, should give you a sense of how safe, you know, our environment is, and also the measures that you need to continue to take. Because now I know they're recommending that, you know, when you're outdoors, you know, that you can not have your mask on because, you know, it's not, you're so less likely to come in contact with the virus when you're outdoors, but when you're in more of an enclosed space, you need to have a mask on until, you know, we have this herd immunity in place where we have about 70+% of people who have been vaccinated. So also just keeping up with the latest statistics, watching the news and watching to see what the CDC and the Illinois Department of Health is putting out too. That should help take away some of the anxieties.
Hey, Deacon Joe, I got two questions.
Lawrence,
Yes,
wait, can Carol had her hand up first, and then you'll go after Carol.
Okay.
Minister Carol.
Yes, thank you so much, Drs. Bell, Clark, and Sangster. I sort of had a question that I guess piggyback off of what Deacon Stella said. Dr. Clark, you talked a lot about relaxation and techniques, and I imagine that particularly with us as spiritual caretakers of our congregation, if you will, that language, right, has a big part of either helping the situation or hurting the situation. And so are there key words or phrases, or are there things that we should perhaps stay away from if we encounter someone that may be having, you know, and I don't know how we would always know, anxiety attacks or some type of psychotic episode where it, you know, might hurt if we say such and such, or it might help if we say something else.
Thanks for that question. So the first thing I'm going to say is if you are dealing with somebody that you think is suicidal, I think oftentimes people think about just asking somebody if like just being direct, or like, are you having suicidal thoughts? That will somehow put it in their head. That is a myth. That is not true. So you can ask very, you know, direct, specific questions if you're feeling like somebody is in danger of hurting themselves, or even asking if they're thinking about hurting somebody else. In terms of other kinds of language, I think trying to, again, is about kind of like normalizing experiences. And so if you're talking about like how somebody is thinking about things, like oftentimes I will, well, actually in my own practice, I use kind of a self-disclosure just in terms of like thinking patterns. These are things that most people have, myself included, right? In terms of like, if I'm catastrophizing, which that may not be the best word, but to say like, if I have really negative thinking, I think that that's a pretty, you know, common way to kind of talk about how people are thinking, and then kind of talking about like, you know, that may make you feel down, that may make you feel anxious. I think words that are kind of really accessible to people, I think are helpful. I think in terms of using words like psychotic, I think that there is some stigma around that kind of a word. So I would encourage, instead of saying something like that, to say like, if you are like hearing or seeing things that perhaps I can't see, or you know, things like that where it's not, may not have as much stigma to it. I hope that answered the question.
Yes, thank you.
You know, there's a icebreaker that I use sometimes when I'm interviewing people, you know, as I'm going through a series of questions. And quite often I'll say, well, are you going crazy or coming back? And that was something that my stepmom used to say. And then I said, well, that's a trick question. You don't have to answer it.
Deacon Lawrence, and then Deacon Michael.
Hey, Deacon Joe, a question, two questions. One for Deacon Dr. Bell. Can you define, you talked about these different types of trauma. Can you define what is trauma and what is its effects on a person? And for Dr. Joe, you talked about depression. Is depression one of those items, or you need a list of those items to constitute depression?
Dr. Bell's muted.
I was trying to get all the list of stuff for the kids in the on the website. So let's talk about trauma. Well, the first trauma is trauma is someone that's been exposed either visually to some type of insult to a person or to themselves or a loved one. They can hear about it. A child can hear about it. They could have heard about it 2 or 3 days ago. Something happened on the block, or it could happen to themselves. That's the first type of trauma. And because certain of us have predispositions genetically and multifactorially in our environment where we can't really cope, we don't have mechanisms to overcome these type of insults. Some of us it's normal for us to feel hypervigilant, anxious, and panicky once we see it. But after 30 days, if we don't have the coping, we don't have the support from our parents and the community, it may lead to post-traumatic stress disorder after 30 days. And what that looks like is really frightening in the child or an adolescent, someone that I may see from I treat kids 3 and up. That's trauma. That's post-traumatic stress disorder that can last for a year, for 2 years, to 5 years. And the best treatment is cognitive behavioral therapy. And kids who can't talk, they have talk therapy, play therapy, and kids older. And the other type of trauma is post-traumatic slavery syndrome. A psychologist, a well-known psychologist, Dr. Joy DeGroy, who wrote a book some years ago about this trauma that we acquired through slavery, how it's a part of how we manage and cope on the plantations, and we develop these mechanisms to protect our children and ourselves. It's like a reflex, and we haven't had time after 400 years of slavery dealing with it. In fact, Dr. DeCroy, yesterday and today is part of a session here in America, and some different agencies here in Chicago they're part of her presentation today. And I think I'm going to be moderating the conversation after her talk. But I have her book. In fact, this is her book right here. Post-traumatic slave syndrome. Okay, so that's something that we haven't even dealt with, period. On top of the trauma today, after Reconstruction and all of this, my kids, and now we're dealing with George Floyd and more to come. So it's like an insult. So we're carrying that around with us.
Thank you.
Okay, and Brother Lawrence, you asked about depression of me. And, depression is actually quantified. It can be mild, moderate, or severe, and depending on how many of those, like 10 questions that I pose, how many you answer in the affirmative, it tells you where you fall in. For sure, when you get to severe, it's usually at least 4 or more of those that you've answered in the affirmative. And particularly if you're feeling like life isn't worth living and you're thinking about, jumping off a bridge or, ending it all, that's definitely a chance where we have to jump in and act. But, like I said, people go through some, down times here and there, we all, feel a little, our moods fluctuate from day to day almost. But when it gets to the point where you're not functioning, you're shutting yourself off from the world, you're not communicating with friends, you're not sleeping, not eating, all those things are some cardinal symptoms of depression, and where some help is needed to get you back on track. So, and as Deacon Stella asked, I will go ahead and send those questions to the chairperson, Madam Chairperson.
And for Dr. Clark, I don't want to leave her out. There's a scripture on Proverbs 17:22 to say that a merry heart is good medicine. And you talked about how we can use music and those things that bring us to life, singing and dancing, those things that will increase our endorphins. that we will that we will try to come back to ourselves out of our low moments. So I just want, just because you mentioned dancing and singing and music, some of the things I like to do, and they do help bring you up out the funk, as it were. So thank you.
Thank you. I'm glad that that was helpful. And I do apologize, but I do have to take off because I actually have a client in a couple minutes. But thank you so much for having me. I will send a list of resources along, and yeah, you all have a good rest of your evening and afternoon.
Thank you.
Thank you for joining us, Dr. Clark.
Okay.
You know, I wanted to say something briefly. I wanted to piggyback on, I think it was Mrs. Minister Taylor was talking about how do you talk to a parent or a child or an adolescent. Let's see, do I have the thing on? How do you talk to a adolescent when it comes to talking to them? You know, you can just say, listen, you know, you can talk in general terms about God or spirituality, because people have different backgrounds. They have different faith, you know, systems. Some are Christians, Islam, or Muslims. Currently right now, I treat men in the Illinois Department of Correction. I'm treating adults again. And so they all have different religions. As long as you meet them, do you believe in a higher power? Is it okay? You know, I'm gonna tell you a little bit about myself. Did I pray for you? Can we hold hands and pray? How have you been feeling? So you let them answer the questions and bring them up to the point. I'm not gonna directly come out and say you're psychotic. This is just not gonna happen. So I just meet them where they are. Just figure out where they are, and they'll tell you.
Just to share a little levity, I was in the airport once, and this young lady was wearing this T-shirt, and the T-shirt actually read, "I put the hot in psychotic." And I said, no, why would me as a psychiatrist see this? And you know, I said, well, that sounds like someone I want to stay away from. But
I want to share this book. I'm a reader, an avid reader. It's called Black Fatigue. It talks about how African Americans and people of diaspora, how we go to work every day, whether it's a corporation or it's nowhere it's a school teacher, an attorney, physicians, how you go to work and you deal with these microaggressions, this racism, how it affects you. And then when you go home, you're dealing with your family. You're dealing with the stresses of putting the food on the table, you know, and the conversations around this COVID and how we're going to raise our kids and where's the money coming from. So this is an interesting book that's been referred to me so I can understand the population and the people that I'm serving.
Deacon Michael and Deacon Gabe.
Okay. Yeah, just real quick. First of all, Dr. Bell, good to see you again. Good to hear from you. Thank you and Dr. Sangster and Dr. Clark for all this wonderful information. There was mention, and I think it was from you, Dr. Sangster, with regards to African American male support, where to find support, websites or anything like that. Could you go over that one more time in the chat?
I'm sorry, I didn't understand the question.
The question was that there was mention of support, mental health support for African American males. And I thought it came from either you or Dr.
I think that was Dr. Clark maybe mentioned
Yeah,
that.
Dr. Clark was talking about a circle. There's a psychologist by the name of Dr. Obari. He has a circle several times a week for African American men on the south side of Chicago. Okay. He has a yoga spot for them. Obari, I think it's Carlson. Around 75th Street, he has a circle where Black men come and meet. And he has a building where they do yoga and they talk about Black issues. And she has that information. I can pull it up. You know, Michael, I can pull it up to you and then send it to you. But let me see if I have it in my phone.
That would be great. I'd like to share.
Pretty active, yeah. He's pretty active in the community.
Sure.
And also, I was interviewed by the president of the American Academy of Child Psychiatry, Dr. Carlson, in Washington, D.C. And I'm gonna send that to Mrs. Poole. And I talked about white privilege, racism, how it's affecting our communities. And I talked about cultural competency and implicit bias. And she became very defensive during the interview. But I was able to handle it. And so now only 8,000 child psychiatrists are going to see this in the nation, but nationally they're going to see it. So I'm being sponsored in the Orange Journal, talking about this racism issue and how it affects our children and cultural competency and white privilege.
Deacon Galen?
Yeah, can you all hear me? I'm in my car.
Yes.
Okay, cool. Thank you. This is so very on time. I'm not sure who I should direct this to, so I'll just put it out there. I do have a family member that they've asked me to deal with this, and I'm not sure that I'm the person for it. But this family member, they hear things and they see things such that sometimes they think that there's something underneath their floor, something outside of their house. They're very paranoid. I don't know how to address this with them. I don't know how agreeable they would be when I've tried to broach it before. You know, they did pretty much balk at it, as I think a lot of people would. No one wants to really think that maybe they have a mental instability. But as time goes forward, it does, to me, it seems like it's progressing. And I don't want it to be said that, you know, on my watch, I didn't do anything, but I don't know what to do. So please advise.
Okay, well, Deacon Rose, my thought was, first of all, how much of an influence is this having on their daily routines? Or, you know, are they still functioning? Are they still getting up, taking care of their
Yes.
hygiene? Are they, you know,
Yes.
so they still function? Okay, okay, this person is probably a little harder to probably get to see a professional, a mental health professional. But one thing or one trick as we counsel people or people who are kind of in denial, so to speak, is to try to empathize with what they're going through, you know, to, you know, try to side with them. It's like, I know this has got to be hard for you. I know you got to have, you know, it's tough to have to deal with this, and just let them know that you're on their side, and let's see what we can do to help take some of this burden off of you. You know,
Okay.
and you know someone that we can talk to, and I'll go with you, or just encourage them in that way.
So,
Otherwise, go ahead.
So are there any children in this family or adolescents, school, anybody less than 18?
No.
Okay. So people go to work and no one at the job site or no one at the community where they frequent has noticed any changes or any issues, or DCFS cannot be, is there any?
No, and they don't live in Chicago.
Okay. All right. So, but what are the ages of the family? Is just a couple adult children with parents in a home, or what's the situation?
They are an adult and they live alone.
They live alone. Okay. So it's usually when situations like this happens, it's not until there's some type of involvement by some legal entity where they're interfering either in a legal aspect, a social aspect. What I mean by that, some type of interaction with the law where they've crossed some boundaries, or something is really standing out that comes to someone's attention, where where institutions have to be involved or get involved. But as far as, I don't know, I think Dr. Sangster, he's a deacon, so I mean he's the person that I think he answered the question. But from that aspect, that's usually.
It seems like, like a lot of people, go under the radar, so to speak. They don't pop up,
Yes.
Having crossed the law or done things that brought attention to them, but they are still suffering, and
Yes.
so it's just a matter of their loved ones to kind of, work with them, meet them where they are, and let them know that you care for them, you love them, and you want to, help them, have less anxiety and stress or whatever they're experiencing, and try to get them, to see someone.
Okay, thank you.
In some instances, when a family member gets into trouble, sometimes you have to go to like a Malcolm courthouse to become the, like, and you have to, do like, do a petition, and, you go to a judge is the only person that can say, hey, this person is not able to care for himself or others, and you can be appointed the guardian.
Guardianship. Yeah.
So the guardianship. So I don't know what city is this, Detroit, Michigan. So in that instance is when you feel the person is at danger. To that point, you can go to the local courthouse and go in front of a judge and say, my 35-year-old niece or nephew is this, you write out a petition. You can go online and download that petition for psychiatric on an inability to care, a danger to self or to others, are not able to provide, basic needs. And then you go in front of a courthouse and you can get, most times, you can get guardianship. Yeah.
Guardianship over an adult?
Yeah, you can, particularly if they have some type of developmental disability or cognitive disability, like someone with autism, someone who's known to the community in the past, who may have been hospitalized as far as some type of disruption in the community, and people are aware of it. If you can write it out, if you can print it out. Recently, I think about 4 months ago, I had a friend's family member. I think they were living in, it wasn't Michigan. I think maybe it was I can't remember, it was Indiana, some state. I don't remember whether Texas or something. And I had them download a petition, and I told them what to write it in. They went in front of the courthouse and got temporary guardianship to make some decisions. And so that person was picked up by 20% of Chicago police officers have some type of mental health training. They went to pick the person up. They was hospitalized for 3 days, and inside of an inpatient psych hospital, you have to go within 3 days. That person has to go in front of the judge to determine if you're going to be there for another 30 days or extended. You can do it here in Illinois too. You can download the petition offline for mental health. And usually it's done at the Markham Courthouse.
Okay, so this is Deborah Higgins, and I have a couple of questions I'd like to ask. I'm a former substance abuse counselor, and so some of the things we used to look for was triggers.
Deacons, in the interest of time, Dr. Joe, if
I'm sorry. I didn't hear your questions. I'm sorry. There's some interference.
Tammy, could you repeat that? You were breaking up. You're on mute now, Tammy.
Deborah was asking.
Deborah had a question, she started talking. So finish with Deborah and then I'll say something.
Okay. Okay, so I'm going to finish my question real quick.
Deborah, repeat your question, please.
Yes, can you hear me?
Yes.
Yep.
Oh, okay, great. I said I was a former alcohol and substance abuse counselor. We used to look for triggers. So I'm asking the first question is, if you guys look for triggers, what are they? And with alcohol and substance abuse, it was alcohol and substance abuse. And I just want to know, can it be anxiety and depression at the same time? And the other question is, if someone is not necessarily forthcoming, are there any probing questions that you can ask to determine the state of mind?
So go ahead, Dr. Sangster.
Okay, yeah. As an addiction psychiatrist, I worked in the field of addiction. I was medical director for the methadone clinic at the VA hospital for 7 years. And at any rate, it can be both. It is depression, anxiety, and quite often the reason that people are abusing substances is because they're self-medicating. They have the anxiety, they have addiction, and the first thing they're going to do is go to the local, bar on the corner or the local, liquor store and get their favorite beverage and and start consuming that to help themselves feel better, or going on the street looking for other stuff that will help calm down their nerves or their depression or lift them. And I've seen so many different scenarios where someone may be bipolar, and with bipolar you get high and manic and racing around, as well as really depressed. And I've seen people when they're high, they will take like heroin to bring them down. And then when they're so depressed, they'll take cocaine to bring them up. And, people do self-medicate and to, their own mental health, as opposed to seeing a mental health professional, mainly because of the stigma. They don't want to be labeled as crazy or, psychotic or whatever, or be hospitalized. But yeah, you do see both. You do see the addictions piece that works in there, which was one of the main reasons, I wanted to study addiction and how it affects mental health as well, because we see so much of that in our community as Black people. I'm trying to remember the other part of your question. Deacon Higgins was.
Okay, so I was asking about triggers. I was asking you if anxiety and depression can be, if that episode can take place at the same time. And then I was asking if someone doesn't necessarily tell you that something is going on with them, or you cannot readily identify that something is going on with them, what are some of the probing questions that you can ask if you suspect something is going on?
Okay. Well, yeah, there are triggers for sure that can put a person into a mental health condition. Traumatic events, and also being re-exposed to something that was traumatic to them can trigger them. And as far as questions, mainly you observe their behavior, because their behavior speaks volumes, what they're doing or what they're not doing. If they're shutting away from family and friends, or, just not engaged in activities that they normally engage in, those are red flags. We see that in children too. They start isolating and whereas they were more outgoing and seeing their grades drop, those are some of the things that you see. But as far as questions, Dr. Clark spoke to that too. You have to be direct. You have to ask them, as a concerned friend or colleague or, or respected person, what's going on with you, and where are you and what can I do to help, but, we have to ask those questions and like I say, but you can see it also in the changes in behavior. I don't know if Dr. Bell may want to add to that.
So someone sent me an interesting picture, like a little text yesterday, and it says, people are not addicted to drugs and alcohol. They are addicted to escaping reality. So 50% of people with bipolar disorder, they use and abuse drugs. Some of them, like Dr. Sangster said, they like the mania, but there's a high substance abuse in individuals with certain mental disorders. And the children and adolescents who I've provided care for, like Dr. Sangster said, you would see a change in their behaviors. They start isolating. Their behaviors change. They're not going to school. They're failing the grades, failing school. And how I like to approach it when I have them in my office, I meet them where they are. I always meet them where they are. Try to remember, where was our last conversation, even if it was 2 months ago or 2 days ago, and break down just, let's a general conversation to try to gain their trust to open up to me. But when it comes to, I let them know now, if you're suicidal, I'm required, but I let them know I have to, because I care for you as your doctor. I'm a worry doctor. Dr. Bell is a worry doctor. I do have to tell your parents. I'm not going to lie to you about that. But other things that I feel is not a danger that you and I can talk in private, we will discuss that and they'll open up. So I'll meet them where they are. Okay.
Well, let me just say one more thing then, because there's a such thing as denial. And some people are just in denial. You cannot convince them that they need to see somebody, or either ask questions. Even if you ask the right questions, they're going to deny what's really going on. Let me, for example, I know somebody very close to me that we could see it, you know, and it was evident that the child was, uh, 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 what do you call it? What's appropriate? I don't know the appropriate word for, you know, but if this is a defensive word, I apologize in advance. Was a lesbian, but the child was in denial as well as the parent. But it was a parent, but there were things that needed to be addressed because of certain behaviors that was happening behind the scenes that could have led to be problematic criminally. So, you know, I'm just saying that if we want to prevent, say, a suicide or whatever incident like that, and we are trying to provide some form of intervention, how do you do that if someone is in denial?
Well, you know, Dr. Sangster, when it comes to a child adolescent and they don't want to disclose to me they're using drugs, and I'm going to request that they drop some urine. I know what that they're using drugs. So people are going to continue to use drugs, and they can remain in denial for years. I have 3 siblings today, and I'll be 60 this year, that are still using and abusing drugs. We're talking about heavy drugs. And here I am, a psychiatrist. I'm a healthcare provider. You know, and I'm a concerned sister. There's nothing you can do but pray for that individual until they accept where they are, and they're not adolescents. And Dr. Sangster, you can speak on this behalf, but I've done everything in my power, taking them to substance abuse inpatient 20 years ago with my connections, providing monies until they accept that they have an issue and can't deal with their underlying, you know, I'm not going to say demons, but whatever the issues are, I just pray for them. And Dr. Sangster,
But you do know I'm not talking about substance abuse.
Yeah,
I
and I'm
use that
thinking,
as an example. I'm talking about anxiety or depression.
Oh, I see.
I'm talking about children as well as adults.
okay.
Go ahead, Dr. Sangster.
Well, one of our mottos is always safety first. And I'm not sure if you're referring to like a child who may be in some endangered situation, you know, and it's hard to, you know, separate them or get them, you know, to speak. Safety is always paramount in every situation. And if it's a child, you can always call DCFS to investigate. I mean, there may be something, there may not be something. But DCFS can step in and, you know, you can just report it or your concerns about what's going on and, you know, trying to make sure that that individual, that child or whoever it is in a healthy or safe environment or place, you know, and put them at less risk for anything happening further down the road. I hope that kind of gave you some answer.
Deacons, due
Thank you.
to the interest of time, we'd like to thank our panelists, Dr. Sangster, Dr. Bell, and Dr. Clark.